There have been massive changes over the last 20 years in terms of what we know and the technology. So for example, there's certain patients we now know we shouldn't operate on because the result with or without surgery is actually very similar. So there's a whole series of patients when I went through my training we were regularly operating on who we now treat without surgery, and that's much better for them. Whereas there's a whole other group of patients where the technology has now improved to the point where we may not have operated previously and we can successfully operate now. A lot of changes happened when we went from a lot of open surgery to a lot of arthroscopic surgery as well. And there's many things that we do arthroscopically now which may have taken weeks or months to recover from, that people, as you say, get out of hospital either the same day or after one day. But the interesting thing about that is not everything's faster. Some of the time when we do the arthroscopic surgery, we slow down their rehabilitation and we take it a little bit more slowly to allow healing to take place because they don't get the same scarring issues that they used to get with open surgery. We're now using computers and robotics a lot more. So for example, knee replacement surgery, the patient will have scans beforehand and you'll have an implant which kind of clicks into place to guide the cut of your saw without having to put a rod up the bone. And the advantage of that is you don't get all the fat and marrow from the bone going up into the person's lungs. So the next day they don't have breathing problems, they get up faster, they walk faster, and they exercise better. In terms of shoulder replacement surgery, shoulder replacement, if you're off by 2 or 3 millimeters, can make a big difference because the components are small and the bones are small. And we now have CT guidance of where to put those implants so we can get it within a millimeter of where it needs to be. And that has made a massive difference to the types of cases that we can do accurately, the range of motion that people get, and the likelihood of the operation being a success rather than failing after a few years.